Well, I would tell you the requirements of participation, better known as the mega rule, has everybody worked up because they use the word mega rule. It's just another iteration of requirements. Our facilities are used to dealing with requirements every day. And if you have people and processes in place, you're going to do just fine. Well, especially because all the tags have been renamed. That's been the biggest piece. You know, it's just general education of your staff, and involving direct line staff is what I think is the most important. Because of the way the new survey process has been set up, there's going to be direct interviews with your residents and your staff, and you need to know what's your staff going to say. What are the residents going to say about how you take care of them and their facility? So if you don't know what they're going to say, you're going to have issues going down the road. So just have good day-to-day communication with your staff and with your residents, and you're going to be just fine. So one of the big processes, especially with phase 2 of the mega rule, has been the antibiotic stewardship program. And antibiotic stewardship is an everyday process within the acute care industry, and adding it to the long-term care industry has been, I think, the biggest change in phase 2. And again, it's just education about antibiotics, education about how to use antibiotics, and creating that communication between the pharmacy, the medical director, and the medical clinical staff of the facility has really been a key point for us that we've focused on. If you don't have a communicative staff, that's really the issue. Person-centered care is all about creating an environment that makes your residents feel comfortable. And it's getting away from rules and getting into how you feel comfortable day to day, making that patient, and see, I just said it right there. They're not a patient, they're a resident. You want to make sure that this is a home for them and not feel like a hospital. So the real key point is creating an environment within your direct care staff that makes a resident feel comfortable and the resident's family feel comfortable, making them sure that they're all part of directing the care that they get. There's always going to be tweaks. There's always going to be state-to-state interpretations of regulations. So as long as you're well attuned and well engaged with the survey teams and the staff that comes to your facilities, you'll be just fine. So we've seen a 5% increase in tags. Now, because of the increase in tags, it's great that there's no civil and monetary penalties, but you know what you're looking for next year when those civil monetary penalties will be enforced. So you have to take it seriously. We're looking at the data and going, what is the data telling us about the tags? It's telling us, make sure you work on your antipsychotic drugs. That's still a big key point. Make sure you have an antibiotic stewardship program and process and can communicate how you work it. Make sure that you're using the right communication within your building and understand what your residents will say, what your staff will say. I know that they thought they were giving us a win with leaving out the civil and monetary penalties. There's so many great providers out there. I'm not sure that was a win. The people who are doing a really, really good job want to be known for doing a really, really good job. And so I think the moratorium has had its upside and its downside. Again, I think it depends on your particular survey team and knowing the environment that your particular survey team in your area of the country, how they operate. So I would say some have been educational. It's been a good learning experience, a good back and forth between regulation and the direct care teams. It's just, you have to know how and who you're dealing with and interacting with the survey team. So I would say a vast majority have been a very good educational back and forth. But as with anything, there are some folks that, are dotting every I and crossing every T and making sure that, hey, you're supposed to be ready. So we really thought that antibiotic stewardship was key. So we've rolled out a complete antibiotic stewardship package for our facilities. And to date, we have not had one single facility receive an antibiotic stewardship tag that has adopted the program that we worked with them.